COVID-19 hospitalizations for children are climbing as the nation grapples with the rising toll of Omicron cases. On average, more than 900 children are being hospitalized every day. Health experts say the best protection against the newest variant is to be fully vaccinated and boosted. Less than 20% of children ages 5 to 11 are fully vaccinated, and there are still no doses available for children under 5. However, Dr. Fauci says that could change in a matter of weeks. CBS News' Michael George reports.
Children under 5 may soon be eligible to receive the COVID vaccine. Dr. Anthony Fauci says that could happen as soon as next month.
Have zero protection against the virus, so do become a little bit more sick than what we saw previously.
This comes as more than 900 children a day are being admitted to hospitals with COVID-19.
We have young children all the way down to 3 months of age in the hospital without any pre-existing condition.
While the youngest Americans are struggling with Omicron, older Americans are faring much better as long as they're vaccinated and boosted.
New numbers from the CDC shows unvaccinated Americans aged 50 to 64 are 44 times more likely to end up in the hospital than their counterparts who have the booster.
The majority of patients who are getting admitted are high-risk patients who are unvaccinated or who are elderly, who have comorbidities like cancer, liver, heart failure, underlying respiratory issues, or diabetes.
There is some good news. In areas where the Omicron wave first hit, infection rates are coming down. New York Governor Kathy Hochul tweeted the state's COVID positivity rate is under 10% for the first time in a month. Michael George, CBS News, New York.
For more on this, I want to bring in Dr. Gigi Chawla. She is the chief of pediatrics at Children's Hospitals and Clinics of Minnesota. Dr. Chawla, welcome. Thank you for being with us. So the CDC has said there's no indication that Omicron causes more severe illness in children, but yet we're seeing hospitalizations for kids at an all-time high. So why is that?
I think it just naturally reflects the proportion of kids who are currently infected. And as that number of kids who are infected grows, we will see a set amount get hospitalized with complications or hospitalized for other reasons and just have COVID at the same time.
So do we know now what some of the long-term side effects of COVID are in children? Do we have enough of a pool to study at this point?
I think what we can talk about is our experience and what we're seeing for kids and the long-term effects, as well as some of the new science that is coming through. As far as the current effects that we're seeing, we do have children get hospitalized with COVID, specifically get ill with dehydration or respiratory effects, and then have a recovery period after that ensues. We also have children who have more of the long hauler syndrome with COVID and really have a hard time just participating in daily gym classes or activities or sports, or just are able to play in the way that they would want to. We do know also that, there is a subset, a small fraction of kids who will go on after their recovery from COVID-19 illness to have a multi-system inflammatory syndrome condition in childhood called MIS-C, which has a really profound effect on illness that can lead to really chronic multi-system disease that requires hospitalization. And so I think there's a variety of long-term effects that can affect children that we know about right now. Some of the new evidence that is coming out is making us also wonder if there's a correlation to diabetes or other conditions. And we're seeing that there might be an increase in prevalence in some of those conditions as well.
Now, Dr. Fauci says a vaccine for children under 5 could be ready as soon as next month. What can parents do in the meantime to protect those younger kids?
Well, we certainly couldn't be more excited about getting a vaccine available for younger kids. But in the meantime, certainly all of the mitigation factors that we can do right now, that adults are doing and kids are doing right now, can be done for younger kids as well. And so that includes mask wearing for younger kids. It is, I think, a mental barrier that adults have, that kids at age 2 and older can't wear a mask when they can. It really is about helping train and normalize that for kids as much as possible, practicing in your homes to get kids to put a mask in place and leave it alone and wear it. Otherwise, hand washing, social distancing, and using testing to really inform testing, home kits and antigen testing to really inform how, if kids are safe and healthy to be participating in activities with other children.
All right. Well, Dr. Gigi Chawla, thank you so much for joining us. We appreciate your medical expertise.
Thank you for having me.